Previously, what we've done is we've highlighted the books and we've tabbed them. So you can see the tabbed books here. And then now we're going to just apply that knowledge and see how we do on the test. So this is a practice test. I haven't taken it before, so it'll be sort of like a good self-check along with kind of like a helpful first step to see if I'm ready or not on it. And we're going to get started here. Okay, so the first question is, a 46-year-old female had previous biopsy that indicated positive malignant margins anteriorly on the right side of her neck. A 0.5 centimeter margin was drawn out and a 15 blade scalpel was used for full excision of the 8 centimeter lesion. Layered closure was performed after the removal. Specimen was sent for permanent histopathologic examination. What is the CPT code for this procedure? So not knowing that off the top of the head, we can see on the answer choices that these ones are all the same. So we can be pretty sure that that's going to be, one of the ones that's certainly there, certainly applicable. And just make sure we have the timer there. So we can be pretty sure that that's one of the ones that's going to be applicable for sure. And then we have to decide between these two. So we have 12004-51 and 12041-51. Those are all CPT codes, so we'll be in the yellow book. So yellow book, we would be 120, so 12, kind of go from the top. So 12004, 12, so I'm in 12. 12004 says basically it's so we've highlighted simple repair, excision of a lesion, scalp and neck, axilla, external genitalia, and the trunk. So basically that with 51. So it says 7.6 004 says 7.6 to 12.5 centimeters. So we have that definitely that's not the right sizing, I don't think. So we have half a centimeter here, half a centimeter, and then full excision of 8 centimeter lesion. So that could directionally be 004. So that's certainly right. And then let's look at 44 really quick. And then 51. 51 is multiple procedures performed after the removal. So it looks like there were of an 8 centimeter lesion. A half a centimeter margin was drawn out and a 15 blade scalpel was used for the full excision of 8 centimeter lesion. So I'm thinking this one is gonna be 7.6 to 12.5. It certainly meets that criteria here with the 8 centimeter here. So I'm leaning towards this as an answer choice. But let's just double check 12044-51. 12044-51. Oh, it actually also says 7.6 to 12.5. So that, again, another candidate potentially. So it might just come down to repair of the intermediate. So I'm trying to look for like the keyword. So do I see repair of intermediate, or do I see simple repair, full excision? Biopsy indicated margins anteriorly on the right side of her neck. A 0.5 margin was drawn out. Blade scalpel was used for the full excision of 8 centimeter. Layered closure was performed after. Okay, so let's continue on the let's just see if we can eliminate this one really quick. So 13132-51. Okay, so that's 2.5 to 7.5 centimeters. So we can certainly eliminate that one out. And then because it's up to 7.5 centimeters, so that's certainly not the right sizing there for the 8 centimeter lesion. So at least we can strike through that one. I'm gonna do strike through. Well, essentially I'll just leave it the way it is in terms of colors. Maybe white it out or make it gray, so it's just, yeah, okay, so that's gray. So we've eliminated that one. The other thing is with these two, sometimes they're all inclusive codes. So let's go to 11626 really quick, because if I look at 11626, it says excision of a malignant lesion including margins on scalp, neck, particularly on the scalp, so the neck. So we have a keyword there. So that's what we had highlighted yesterday in pink. Then we have essentially the blade. All the blade stuff is not necessarily needed. Excision of the malignant. So then we have margins anteriorly. Full excision of an 8 centimeter lesion. The keyword that's missing is excision malignant. There's a full excision, but I don't really see malignant, but it has to be that. I'm not really sure if it covers all of them. Layered closure was performed. 626. Okay, so 12004-51. Let's go to that one more time. So 12004. Okay, so that's 7.6 to 12.5. Simple repair. Superficial wound, scalp, neck. I don't really see superficial wound. Don't really see simple repair on there. I don't see hands or feet, extremities including hands or feet. I do see neck, which is good. Simple repair. It just looks like there's a excision done and then a layered closure performed after the removal. So it's pretty likely that it's 004-51. Not sure if it's bilateral either. So 12 malignant anteriorly on the right side of the neck. A 0.5 margin was drawn. 15 blade scalpel was used for the full excision. The best one I think on this one feels like that one. Going with the theory that the least restrictive codes, the ones that kind of cover the most ground, are the ones that I'm covering here. There isn't any layered closures. I'm not seeing some of the hot buzzwords here, keywords. So I'm gonna pick that as my answer choice and keep kind of go to the next question. And I think timing wise, it's kind of essential to be on kind of keep in time, because it is a time test, I think. But I think it's such a 5 hours and 40 minutes. It's a long test. Although our timing on this one is off by like, we spent 9 minutes on this one. Should have been a little bit faster. Okay. So then it's 30-year-old female is having 15 square centimeter debridement performed on infected ulcer with the HR on her right foot. Okay, so there's a lot of stuff. When I just quickly scan the answer choices, I see all of them are kind of different. So what I can do quickly is, what is this? It's the website that opened up. When I scan all the answer choices, what I can quickly do is just sort of look at this and make the right selection. Maybe see if I can narrow it down based on what we've highlighted in the book. Okay, so 11012. So 11012 says skin. It's basically talking about skin subcutaneous, and it's a sub, so foreign material, open fracture. Do we see foreign material over fracture anywhere? Debridement, bleeding. No, and then it says on the actual code, it says for that one, it has skin, subcutaneous, tissue, muscle, fascia, muscle, bone. Debrided all the way up to the bone. So I guess it could be that. Let's keep going for 2 seconds. So let's see 11043. Debridement muscle fascia includes epidermis, dermis, subcutaneous is performed first 20 centimeters or less. So yeah, that sounds like the right answer because it's 15 square centimeters. Then we have 15 square centimeters, so that meets that one. That's the story, so I don't think any of that's important. Sharp dissection. The ulcer was debrided all the way down to the bone of the foot. So debridement of muscle fascia. So it can't be this one because it says what we've highlighted here. It says first 20 centimeters or less, and there's no skin and bone. So going back, we've written on the side here skin and bone. So that's gonna be the answer choice is there. To make sure the sizes. So yeah, it says first 20 centimeters or less. That's highlighted. And then so the answer choice that I'm going to select on this one is green on 11011, or answer choice B, and then move on to the next question. Okay, so probably this one, it's a long question, so I'm going to look at the answer choices first and kind of see if I can narrow down some sort of like a differential diagnosis here. So I'm thinking, okay, all of these are the same, so there's no point looking those up. If we can narrow down between 12014 and 12053 as to just directionally which one's the best one, I think we'd be in the best spot. And then all of these are the same. So basically it's going to come down to, I believe, so it's going to come down to basically whether it's this or that. And then, okay, and then it's either, all of those are the same. So then if we have those, I believe it's going to come down to this code. Yes, it's going to come down to 12002-59 and then 11042. I think at the end of the day, that's going to be the end. And we can come pretty close, I believe, on the test here. It might just be that's not even applicable. Those last ones aren't even applicable. But let's see. Okay, so we have 12053. Okay, so that's again integumentary system 12, or surgery, yeah, integumentary 12053. Okay, so that's essentially 5.1 to 7.5. 5.1 to 7.5. So that's it's talking about repair intermediate right arm leg deep cuts measuring this. She lacerated her forearm, cheeks, chin. Total length of lacerations was this. ED forehead, cheek, chin. Had debridement cleaning. 6.0 proline sutures. Arms and legs were repaired by layered closures. 6 vicral subcutaneous sutures and proline sutures on the skin. The hand and foot were closed with adhesive strips. Select the appropriate procedure for the visit. Okay. Yeah, so basically the lesion is laceration was this. Deep cuts were 5. Her right hand and right foot total was 3 centimeters. ED physician repaired the lacerations. So first off, he repaired the lacerations. So that's green because that's something he did. The arm and leg were repaired by layered closure. So basically he did a layered closure on the arm and leg, so that's a separate procedure. And then subcutaneous sutures and 6.0 vicral sutures, subcutaneous sutures, and proline sutures on the skin. So that would be, I believe, so you did a layered closure with the vicral. Hand and foot were closed with adhesive strips. Select the appropriate procedure code for this visit. Okay, so let's see. We are looking at basically repair intermediate wound. So 12014 is 5.1 to 7.5. That one's kind of confusing. I'm taking up a lot of time. I'm going to skip that one and I guess come back to it. Mark that one in another color, red. Okay, next is these ones. So these ones are a little bit trickier. So we have essentially 52-year-old female has a mass growing on her right flank for several years. It has finally gotten significantly larger and is beginning to bother her. She brought to the operating room for definitive excision. Incision was made. Okay, so she's the doctor did incision. Let's look at the answer choices really quick. So it's gonna come down. All of them are different. So we could go to 21931. The first codes are all different. So we could kind of just get the answer if we can get the first code right. So 21932. Excision, tumor, soft tissue, back of the flank, subfascial, example intramuscular, less than 5 centimeters. So it says, so it's 3.2. We don't have anything highlighted on that one. Let's look at 3.1. So 3 centimeters or greater. So approximately 4 centimeters. So there is, did the doctor do an excision? Finally, 4 centimeters. Okay, so that's pretty good. That matches. So that 4 centimeters would directionally lead us to pick answer choice C. Mass was down. So let's just double check. Excision, tumor, soft tissue, back of the flank. Lipoma approximately. This was excised. Okay, so did the excision. So surgeon did the excision. Electrocautery. So that's the procedure that's used. So let's see if the procedure matches. I think this is the right answer because it's gonna be 21931, 4 centimeters. If I look at some of the other choices like 32, it's less than 5 centimeters, so it can't be that one. 35 is also less than 5 centimeters, so it can't be that one. And then 925 is 925 is deep. So it's sort of like biopsy, soft tissue, back flank, superficial. This was excised. So this doesn't look like it's a biopsy, so I think we have the right answer there. I think we're finally making some time back. Okay, so these ones are long, but doesn't mean they're difficult. I think all we have to do is kind of analyze the answer choices really quick and pick out the right keywords and select the answer choices. I think reading all of this might be not the smartest idea. It might take up a lot of time. So 25628 RT. Okay, 25 and RT, well, it's all the same, so it doesn't really honestly matter for this question. 25628 25628 says open treatment of carpal scaphoid navicular fracture. So we have essentially so 25624 is with manipulation. RT. So it says basically with manipulation, so that's we haven't highlighted anything there. So we have close treatment of carpal scaphoid. Do we see that keyword? Close treatment of. Let's see what the patient running over anesthesia. Blah blah blah. Skin flaps were elevated. Cutaneous nerve branches were identified. So what did he actually do? Kaiser, then guide wire extending proximal pole, guide wire position appropriately. This is sort of like the procedure. Internal rigid fixation accomplished. Wound was irrigated and closed. Okay, so wound was irrigated and closed in layers. So that's something that was done. So that's codable. Sterile dressing was then applied. The patient tolerated the procedure. That's kind of extra stuff. A dorsal cardiolotomy, capsulotomy was done, and a fracture was visualized. Okay, so there was some visual going on there. I'll do a edit undo there. Capsulotomy. Okay, so we'll look at whether or not we see that here somewhere. So okay, 25628 RT says open treatment of carpal scaphoid. I don't know if I see carpal scaphoid in this question anywhere, so I'm gonna assume that's not the right thing. 24, so it's not 28. What about 24? Close treatment of carpal scaphoid with manipulation. I don't see carpal scaphoid, honestly, unless it's embedded in there somewhere. Okay, next one is 25645 RT 645 open treatment of carpal bone fracture. I think I saw that. So we have, did not appear, incision was made over the wrist flaps, elevated cutaneous nerve branches were greatly retracted. Capsulotomy incision was made. Right extremity was prepared and draped in sterile manner. Guide wire was in position, blah blah blah. It's like a wound closure. There's not even there's not even a fracture. So 25645 RT, so let's go to 25645. We've kind of done that. It says open treatment of carpal bone fracture, so there's not a bone fracture, I don't think there. So 25651 percutaneous skeletal fixation ulnar styloid fracture. it says right wrist, and then we have cutaneous nerve branches. I'm not sure. I think I'm gonna skip that one and come back to it, honestly, perhaps at the end. Let's see. So an infant with a genu valgum was brought to the operating room. Okay, so let's see. Answer choices. One question answer choice. The 27470-50. So you have 27470. So we have non-union or malunion. That's kind of what's highlighted. Okay. So let's see if we have the growth plate incision. Yeah, I don't see the word non-union or malunion. So 7570. I'm gonna say it's at the moment not applicable. 27475. 27475. Arrest epiphyseal. Any method. I see that. 75. So epiphyseal. You don't really see that. Repair of the epiphyseal. So skip. Okay, so these two not matching. Let's see. 27477-50. Okay, 2774 is in tibia and fibula proximal. Do we see tibia and fibula anywhere? Or do we see... Well, the anatomy has to match, so I think we will see local growth plate immediately taken to the fascia. Nope, I don't see it, so it's probably not that one. I think it only just leaves D, but I always get uncomfortable picking that after having gone through that process, so let's just double check. Arrest hemiepiphyseal distal humor proximal tibia. I see knee, see arm. It's probably worth coming back to this one. Honestly, probably taking up too much time on these. So we have 36556. Okay, so we have age 5 years or older here. So let's see, 67. Okay, definitely older. 556. The strategy would be the same. All of these are different, so the first code would determine generally speaking, the answer choice. So 556, 5 years of age or older. Insertion of non-tunneled centrally inserted central venous catheter. Non-tunneled central venous catheter. Do we see that? So let's see. Patient. Central venous catheter. Okay, so how did the catheter get placed? So we have tip of the appropriate lens secured to the device. Port was placed. Subcutaneous pocket. Everything sat nicely. Underlying soft tissue, silk stitch. CPT code reported for this procedure. Okay. So it's tough to say sort of exactly what's going on here. So it doesn't look like it's that first one for sure. The age matches, but it doesn't look like it's a non-tunnel centrally located catheter. 36558, 5 years or older, centrally inserted central venous catheter. Okay, so catheter was placed, and then you have without subcutaneous pump or port or pump, younger than 5 years of age. So I don't think the person's younger than 5 years of age, but it's talking about yeah, this one, neither one of these actually fit. So let's see, 36561. Insertion of tunneled centrally inserted central venous access device. We have a catheter, so we have that for sure. Younger than 5 years of age. And then the last one is 36571, so that's the and 571 is tricky because it's out of order, so we have to hunt for it. 571. Seven. So out of order again. 37. I'm gonna say, so these ones are ligation. Five 3 7 5. It's out of order without any guidance, so it might be, I don't know if I'd be comfortable picking any of those, because it might be a trick to kind of waste time, although it could be the right answer. I think I see catheters a lot on the other ones, so I'm gonna say that one, leap of faith, not the right answer. It's got to be one of these three, because they're kind of closely related. 36556. So let's see. So age 5 years or older, so that's good. Do we have peripherally inserted or centrally? Is it tunneled or non-tunneled? I think that's what it sort of comes down to. I don't see. It is tunneling, so that is tunneled. So tunneling basically implies that if it's tunneled, then we have 36557 has to be, or 36557 or the associated 36558 has to be the right answer. Phew. I think, yeah, the timing, I'm going to be off on the timing, but that's fine. The practice test. Okay, so let's see. A CT scan identified moderate size right pleural effusion in 50-year-old male. Basically, I'm gonna instead of just jumping to the answers, I'm gonna get a feel for what they're doing from here. So CT scan, pleural effusion of the 50-year-old male. This was estimated to be 800 cc fluid. CT scan. Needles used to puncture through. It's kind of like a futile exercise because I'm not a doctor, so I don't see exactly what they're doing. I just have to find the code. So let's see. Let's go back to the old strategy. So 32555. Okay, so with imaging guidance is what that says, and it's basically thoracentesis needle without guidance, imaging guidance. So let's see if it kind of gives us a little bit of a qualifier somewhere. So under ultrasound guidance, so ultrasound, okay, imaging, so it can't be 32544 because they did use ultrasound. What about, yes, it can't be that one. 557 with imaging guidance, so it could be that one. 556 drainage without guidance, so it can't be 556. 555 with imaging guidance, so it could be that one. So it could be 555. Yeah, it could be 555. It can't be 6 because that's without guidance. And then 550. Insertion of indwelling tunneled pleural catheter with cuff. I don't know if I see all that. But let's see. Pigtail catheter is inserted. Guide wire is secured by stitches. Okay, so we have thoracentesis, pleural space without guidance. It doesn't. None of those. I mean, it's just almost like a different language even they're using here. So let's see. 32550. Insertion of indwelling tunneled. Needle was punctured through the chest. Guide wire. Aha. So I do see guide wire there. Under guidance and guide wire. So those are probably the keywords here. So we have includes connection drainage system when performed open separate procedure. No, there's no guide wire on any of these answer choices. 32550. I don't know. I think I'm gonna select that one. It's like with guidance, so it has to be either 555 needle. Do I see needle? Yeah, I do see needle. So it can be. What about 7? Indwelling catheter. No, they use needle instead. So it has to be. It's not an indwelling catheter, so it can't be that one. They're using a needle. So that's no color. And then this one is 555. So that's green. So basically 555, and it matches all the criteria, I believe. So we have without imaging guidance. So we have just laughing because it's taking up so much time. So we have guide wire. Guide wire wasn't the right word. We have needle. So it's the only one that says needle or catheter. So 555, and it's with guidance because it's ultrasound. So there's guidance. So that's 555, I believe. Okay, let's see. Question 9, 35301. 35. Okay, so 35301, thromboendorectomy. Okay, it's that big a word if it's the right answer. First off, I think we have, if it's 301, then we have to do a little bit of work. But if it's 302 and 35311, then we don't have to do that much work. So if it's 301, thrombodenectomy, pinch graft, cardioid, vertebral, subclavian, neck incision, any of those words, it's kind of how I'm going to approach this one. So carotid, sorry, not cardioid, carotid. I do see carotid artery there. So I do see that keyword. Dissected free. So did they, including pinch graft? It's unlikely that they'll put that word. It's almost like a giveaway. So 301, and then let's see if it's 35390, or if there's any trick there, like do not report with 35390, just written there. It's not. Well, let me see. 35301. Yeah, it doesn't say that. So 35390. Okay, so 35. Reoperation, carotid, thrombodectomy. So I see carotid there. Did he do a reoperation? I don't think he did that. Pick that one. I don't think he did a reoperation more than 1 month. Oh, maybe it's more than 1 month after. I don't think I read carefully enough. Let's see. So carotid, 90% left internal. Neck, patient was systematically heparinized. Okay. Cool. Yeah, that's the best one that I see there. I don't know if there's enough evidence in there to slap on that extra code, so I'm gonna pick the least restrictive and kind of move on. Let me just check. Superficial femoral artery. It says carotid, so it's not femoral. So that's, yeah, I think I'm pretty confident with that one. Okay, next one. Let's see. 52-year-old patient was admitted to the hospital for chronic cholecentesis, for which laparoscopic cholecystectomy was performed. Let's see what the answer choice is like. Okay, so this is one of those long questions, but then if we find the first code to be the right one, I think we can just kind of pick it and move on. So 47562. Let's look at that one. Four, 7, 5. Okay, so 475. Okay, laparoscopy, cholecystectomy. So do I see any laparoscopy, cholecystectomy, surgical, any of those hot words? I don't know if I see any laparoscopic. I see it. So there is a laparoscopy there, and then so that's just in 2. So we just pick it and move on. without checking all the other ones. So let's see, 562. What about, like, let me just do a quick gut check. Cholecystotomy. Do I see that? I do see that. Cholecystotomy there. Laparoscopic. It's like a big buzzword. It's like right there. So it's actually on 600 as well. There's some stuff. And if it's laparoscopic. For laparoscopic approach, see 47562 to 47564 is like the so 562 to 564. So it's kind of between 562 and 564 then. So 564, cholecystotomy with exploration of common duct. Did he explore any ducts? Inserted direct vision, fundus, gallbladder appeared chronically inflamed, dissection was carried out. I don't see any exploration going on. I'm gonna pick that one. Kind of go to the next one. It's good. All right, 10. See how we're doing on time. So probably doing bad on time because these are taking a long time. So we're 10 questions, 3 minutes a question, about 15 minutes behind. So we might not finish if we don't pick up the pace. So let's see, on time according to this, the practice test, so I can just extend the time if I wanted. So we see 11, learning process. So we have 11, 70-year-old female, has a history of symptomatic ventral hernia, was advised to undergo laparoscopic evaluation for repair. Long one. We have, let's jump to the answer choice. 49652. 49652 is laparoscopy. Gotta find that word in there somewhere. Laparoscope. See that? There's a few people that say, if you find the right word in the first try, just pick it and move on to the next question. And I'm thinking, like, I don't know if I'm that confident in this, but I do see the word laparoscope, so that would be my top choice. Let me just gut check some of the other ones. So 5-3, incarcerated. Okay, so it says do not report 49652 with 44180 or 49568. So it can't be that one for sure, because those two codes just don't belong together. And I'm pretty sure if I look at 49560, 49560. Okay, repair initial incisional ventral hernia reducible. I don't know if I've seen that. Okay, I see hernia. Laparoscope was... Yeah, so the hernia might be a trick one, because I think this is the right answer, because the 5-3... What was I looking at? So I was looking at 7-0. These codes start to mesh together. So we have 49652. That's the one we picked. And we said it can't be that one. 60. So we're looking at 60. So we have repair incisional ventral hernia reducible. It doesn't have all those words in there. Like, it has the area of the hernia. That's kind of where he directionally did the procedure, according to this. But the laparoscope, where the laparoscope would be inserted, I believe would be the right answer. So I'm going to pick B and move on. Okay. And yeah, move on. I keep looking at that one. Maybe I missed something. So let's see. Patient is 50 years old, gentleman who presented to the emergency room with signs and symptoms of each acute appendicitis. Veristep TM Tokar was inserted. So what did the doctor actually do? So he inserted some stuff. He did a inflammabilical umbilical incision, 5mm versus step TOCAR. Okay, and all the codes are different, so it's probably best to just jump to the smallest one here. So we're going to be on 44950. Okay, appendectomy. So 44950. So we have, this is, I don't know if I see any appendectomy, so it can't be that one. Let's go to 60. So we have 60, 44960, ruptured appendix with abscess generalized. Is there an appendix there? Okay, so he got brought in with the appendicitis. Laparoscope was introduced. TOCAR. Rupture noted. Base of the appendix was then divided. Okay, so he did all that. So he did the laparoscope. Okay, so I think it might be 70 because 60. Where's 60 on this? Four four nine six zero. Ruptured appendix with abscess generalized. Yeah, it doesn't match. I think 70 matches, because if I read it here, it says laparoscopy, surgical, and appendectomy, and I see appendicitis, and it looks like he did he removed the appendix here, so that's appendectomy. And then, sure enough, it sounds all this verbiage actually sounds like it's surgical, so it's surgical. And then you have laparoscope, and we saw that hot word buzzword there. So I think that's what I'm gonna pick and move on. Okay, 13. So we have 45-year-old male donating his kidney to his son. So kidney donation. Nice thing, again, it's one of those questions where all the answers are different. So start with the smallest. 50300. Donor nephrectomy, including cold preservation from cadaver donor, unilateral or bilateral. Okay. I don't know why I selected that just now. It shouldn't be. I haven't done the evaluation yet. Okay, so we have donor nephrectomy. Okay, from cadaver donor, unilateral, bilateral. Okay, so what do we have here? Nephrectomy. Dissection of the renal. Kidney isolation. So nephro. It sounds like you can remove the kidney, so that's nephrectomy. So it could be unilateral or bilateral. I think this is unilateral because I'm assuming the father wants to still continue directionally living in this situation. So we have stapler was divided. Ooh, okay. So we have including cold preservation. Did they put it in? Cold preservation placed under ice. It's got to be, I think it's got to be that one. Pretty confident. Remove the kidney, put it on ice. It says donor nephrectomy. Remove the kidney, including cold preservation from cadaver donor. Oh, not cadaver donor. This is a real life human. Can't be that one. So we have 20. Open living donor. Right under it. I think it's this one. Perfect. Awesome. That's why, yeah, like I think the folks that generally say, oh, pick the first one, and if it kind of matches, just pick it and move on. You have to kind of maybe, unless you're a doctor and you can kind of decipher this and know exactly what's going on and you've had that type of training, I don't know if I'm confident in just picking and moving on. Picking that one the first one that I see and moving on. Okay, next one is 67-year-old females having urinary incontinence with intrinsic sphincter deficiency is having a cystoscopy. Wonder why I'm reading the question. So I'm gonna do the smallest one first. So 57287 really quick. Five seven Oh my god, it's one of those ones that's out of order because it goes from I'm on 5'8" actually. 572 87 572 87, yeah. Removal or revision of sling stress incontinence. Okay. Do I see that? Aha, incontinence. Do you see that word? And then sling operation. Sling operation. It's a lot of cool buzzwords there just on the first one. Pick. I think if I have like two highlights, I'm pretty confident in picking that one rather than just having one. Let me look at 8.8 really quick. Sling operation. Okay, it has sling. Stress incontinence. I just don't see stress there. 8.8 sling operations. Fascia and synthetic. I don't know if I see that. I think it's B. Pretty confident. Picking it. Okay, 15. 16-year-old male baby is in a pre-circumcision to redundant foreskin that causes circumferential scarring from the origin of circumcision. Something about circumcision, pretty much. All the answer choices are different, so let's start with 54150, the smallest one. Okay, so 54150. Circumcision using clamp or other device with regional dorsal penile or ring block. Aha, so is it using a ring block? No, they're using something else here. Using clamp or other device, dorsal penile ring block. 54150. Foreskin was pulled back, excess foreskin was taken off. They're not clamping the skin there, so that's not, I don't think that's the right thing. 160. Surgical excision other than clamp. Yeah, I think it's that one because they've made a surgical incision. And then 54163. Let's see, 54163. Repair incomplete circumcision. I think you completed it. Yeah. I don't know. Okay, yeah, I think I don't have any reason to believe that it wasn't completed. Anesthetic was injected, excess foreskin was taken off, so that's the circumcision part, and then sutured together. Circumferential anastomosis to connect it. Okay, well, that's the right answer probably. So let's see, 5-year-old female. Again, longish. But let's see, all the answer choices are different, so we can start with on this one, 56441. Lysis of labial adhesions. Okay, do we see that? Brought to the operating spine under general anesthesia, labia majora. Lysis of labial adhesions. Under general anesthesia, retracted, granulated chronic adhesions were incised midline both anteriorly and posteriorly using granulation tissue excised either side. What code should be used for this procedure? I don't know. Let's see. So I don't know if I see that one. So what were we on? We were on 56441. Lysis of labial adhesions. I don't see lysis, but I see incision. I do see labia majora, so that's labia. Incision. Okay, so then we have nothing highlighted there either. So we have, okay, so kind of on our own on this one. 441, lysis of labial adhesions. Let's see if I see labial adhesions anywhere. 56441, lysis of labial adhesions. Let's go to the next one. So we have 57061. Destruction of vaginal lesions, simple, laser surgery, electrosurgery, cryosurgery, chemosurgery. I don't see any of those words. Skip. So it's not that one. 58740. Lysis of adhesions. Excised. Okay, so I don't think it's lysis. That's the key word. So we have, excised. There we go. Lysis of adhesions. Is lysis the same thing as excision? I don't know. So let's see. 58660. Laparoscopic surgery with lysis of adhesions. Procedure: ovariolysis, sphingolisis. I have no idea. I think we have that one, but then labial adhesion. So she does have a lot of adhesions in the labial region. Under anesthesia, labia majora is retracted. So basically the doctor removes them. Did he do laparoscopy? How did he? She's brought into the supine position and is retracted, and I don't think he did any laparoscopy. He just saw it, and I think he just did it. So it can't be 58660. Can't be that one. 56441. 56441 lysis of labial adhesions. The simplest one. I think it's probably that one, because if I look at the choice, lysis of labial adhesions, it's just done. All the supine stuff and none of the other stuff matters. I mean, it's probably the simplest one of all of those. Okay, this is a tricky one. It's got a bunch of ICD stuff. And, the one that's going to be the deciding is probably best to start with the one that's doubled up here. So 62365. And then let's get a feel for what that is. Removal of subcutaneous reservoir or pump previously implanted for intrathecal or epidural infusion. Okay. So we have removal of subcutaneous reservoir pump previously implanted. Removal of previously implanted and pump. That's a lot of words all into. It's a lot of hot words in there. It's always. I'm gonna directionally say, yeah, it's this for sure. 62355-51. Removal of previously implanted intrathecal or epidural catheter. So that's what I'm trying to look for now is the next right one. So I think the deciding factor is going to be whether it's 50 or 55. 62350 says implantation revision positioning for long-term medication administration. Pump was irrigated with saline. Dissection was carried out. There was evidence of infection, some fat necrosis, in which cultures were taken. Intrathecal portion of the catheter was removed. Next pump pocket was incised and the pump was dissected from the anterior fascia. 7mm Blake drain was placed in the pump pocket through incision. I don't know if he did anything long term there. So my gut feel, I think it's that one. And there's another couple of tricks that I've learned. Okay, so let's say for example, if there's a differential between these, sometimes you can just look at that and quickly pick the answer. But I'm not sure if that's really necessary here. I think we've got it. So 62355, really quick. 355. Removal of previously implanted intracatheter or epidural catheter. Removal of previously implanted. And that's all the buzzwords. All packed into there. So that's. And to me, 355. It's the right answer, probably. Okay. 18. The patient is a 73-year-old gentleman who was noted to have progressive gait instability over the past several months. MRI demonstrated ventriculomegaly. It was recommendation that the patient proceed forward with the right frontal ventriculoperitoneal shunt placement Codeman program. Okay. So yeah, he's getting surgery pretty much. And then we have to figure out the correct code. Okay, so 62. (622) 20. No, 62190 is a good place to start. So 62. Creation of a shunt subarachnoids. That's just not even. I don't even. Yeah, I don't. Oh, shunt right there. Ventrioperitoneal shunt. Hidden. So that's 62190. Is that creation of a shunt subarachnoids, jugular articular? It says ventriculoperitoneal, not trans. So it can't be. Creation of a shunt subarachnoid subdural atrial jugular articular. Yeah, there's no ventriculo. I'm not sure why I'm struggling with that one. Subarachnoid peritoneal. Ventriculoperitoneal. Okay, so it's probably 190, but then let's look at. I think it's probably that one because it has the word shunt, creation of a shunt. So that's there, and then it's peritoneal, even though it's ventriculo, and it just says peritoneal with a dash, subdural dash peritoneal. So I'm hoping the ventriculo comes with it. Let me just look at 62223. 1 second. Ventriculo. Wow, beautiful. So that's the exact word. See, that's why it's hard to just pick the one that has like few of the keywords. It's never comfortable with that. You just have to look through the answer because it's just ventriculoperitoneal. It's like the whole word is there. Creation of a shunt. Ventriculoperitoneal. Yeah, it has to be B. Okay, what is the CPT code for depression of median nerve found in the space in the wrist on the palmar side? Decompression of the median nerve. It's simple, but I think there's a lot of choices to go through. I'm gonna see if it's easier to do this with the back of the book. So let's see, median nerve. So let's see, found in the space in the wrist on the palmar side. Decompression. So it's got to be to like a coding thing. We have to look at the D. Decompression. Okay, so decompression of. It's a lot easier to do it this way, actually. CPT code for decompression of median nerve found in the space in the wrist on the palmar side. Decompression. Median nerve, decompression nerve. Wrist and palmar side. So do I have any like wrist? have hands. It's probably best to skip back and go to the original strategy, which was just kind of looking at the codes and going from there. Probably not in the back. It's difficult. Probably need a lot of experience for that one. 64704. Let's see. Nerve, hand, foot. That's the first one. Okay, maybe it is the first one. So let's see. Space between the wrist on the palmar side. But it says neuroplasty. So it just can't be that one. We're looking for decompression. So that's 64713. That's still neuroplasty. Can't be 64721. Median nerve. Again, it says neuroplasty. Whenever it comes down to the last one, I know I'm probably doing something wrong here. So 9. So I guess decompression is neuroplasty because all of them have neuroplasty. I just have to look at median nerve, maybe wrist, maybe palmar side, maybe. So I see all those buzzwords in this one. I'm gonna pick that one. So it says, for example, it has the words, it doesn't have decompression, but it has median nerve. No, well, no, it actually has ulnar nerve. That's a different nerve. Take that one off. Maybe 621. It's that one, because that has the buzzword median nerve, and then it has the buzzword carpal tunnel. So I think it's on the wrist, palmar side of the wrist. I think that's where the carpal tunnel is. Decompression. I guess neuroplasty or transposition is the same as decompression here. So that's I think among those choices, I'm pretty confident that it's 21. 13, brachial plexus. That's completely different. I think brachial plexus is like around the neck, and it extends everywhere else. Yeah. Okay, so 20. 2-year-old male has a lesion on the upper and lower right eyelid. Okay, answer choices 67800. Okay, excision, chalcization, single. Chalcization is there. It's like multiple. I think they did multiple on him. What about 800? So they did it on both the upper and lower eyelid of the right eye. They did multiple. So since they did multiple, I think it has to be the multiple code. Let's look at 800 really quick. So we have 800 single. I think we've established that it's multiple. So then 800 67808. Under general anesthesia and requiring hospitalization. They use anesthesia. They did use anesthesia. So it's probably 808. Single or multiple. Wow, that's way more comprehensive. Because it says it could be either single or multiple. General anesthesia. A lot of choices lighting up there on that one. So 800, it's not that one because that's a single. 805, okay, it could be that one. 800, that's single. 805, 801, multiple, same lid. No, they actually use both eyelids, upper and lower of the right. Oh, okay, so but it doesn't, the only one that has the anesthesia is 67808. So I'm gonna pick that one. The rest of them, they're missing the anesthesia. Next. Okay, so 80-year-old patient is returning from gynecologist's office. Pessary cleaning. Patient offers no complaints. The nurse removes, cleans pessary. Vagina swab, betadine, pessary replaced for F/U in 4 months. Follow up in 4 months. What is the CPT code? So let's analyze these. So it's gonna come down to one of these Z codes. And then no quick strategy. So we actually have to find both in these types of questions. So we have, and I'm guessing it's probably like 202 because I'm probably trying to test. Okay, so 99202. So the 9s are weird. This one I believe is up front. So 99200. So it's at the very front of the book. 99202. 80-year-old. How long was the? So it doesn't offer any time. Evaluation, which requires medically appropriate history, examination, straightforward medical decision making. Yeah, it sounds like it's relatively straightforward. The person comes in, doctor sees or the nurse sees them, they remove. Follow up is in 4 months. Pretty straightforward. So I think it's 202. And then let's look at the Z code. These ones are always a bit messy. So let's look at so we have to go to like the diagnosis. So Z would be okay, so yeah, the 46Z, that's the ones that are kind of like the follow-up codes, I believe. So you have to go to Z. So I don't think we tabbed this correctly. It has to, I think it's better if it's like A through Z, because that's how it's done. We did it 1 through 21 to kind of mentally. Okay, anyway, so that's Z 46.9. So Z, so that's 21 on the tabbing system that we went over. Z Z20. Z46.89. Okay, I'm on the wrong section here. Z encounter fitting adjustment of other specified devices. That doesn't even make any sense. So we have 46.89. So we're between 46.9 and 89. Pessary is replaced. So this encounter, it feels like it's encounter for a fitting or other specified devices. Since the nurse, so 89 says encounter for fitting or adjustment of other specified devices. So we're gonna say just the and pessary. Pessary is that other specified devices is replaced. So 89 says of other specified devices in counterfeiting. So this device is specified, so I believe it's 89, so it's A. The pessary is that device that's specified in this one. I'm thinking it's 89. If it was just like, oh, the patient came in, there was some device, then I'd probably pick that one, unspecified code. So we do kind of know pessary, betadine, that type of stuff. Might be Z46.89. Okay, patient was in ER complaining of constipation with nausea, vomiting when taking Zovirax, herpes, and then Percocet for pain. Nice thing is, it's in the CPT, all the codes are different, so why waste time on the question necessarily? Just kind of get a good feel for admitted to the hospital, management of the problem, detailed history, comprehensive. So we got to look for all of these on the 99s. Detailed history, comprehensive examination, medical decision of moderate complexity. So let's see, 99 upfront. So all of these 99s are upfront. So 99825 or 285. Emergency department visit. So we have for evaluation and management of pain, which requires these three key components. Comprehensive exam, yep. Comprehensive exam, comprehensive history. It says detailed history. Detailed history is like 84. So I'm going to say that's 84 is more likely of moderate complexity. That's perfect. 84. Awesome. So it says basically detailed history. Detailed history, we have that comprehensive examination. Detailed examination. 21 medical decision making. Yeah, so I think it meets all the of moderate complexity. So it kind of meets all those buzzwords. So I'm gonna pick that one and move on. Although I'm skipping my own rule here for 2 seconds. It's like an ED visit. Emergency room, yep. Emergency department visit. What is 99221? Just for my learning. 99. Okay. Initial hospital care. I don't know if I have comprehensive examination. Straightforward or low, so it can't be 21. What about 22? Initial hospital care per day fee. Okay, so it could be like 222. But it's ER. ER is 84. Okay. I'm gonna quickly use the bathroom and be back. I think we're not supposed to do that on the actual exam, but since it's a practice, I'm gonna make sure to do that right now. Okay. So we continue on. A 20-day-old infant was seen in the ER by neonatologist admitting the baby to NICU for cyanosis and rapid breathing. Neonatologist. Okay, so we have analyze the codes really quick. So we have 99291. All of them are different, so we could start with the lowest one, 99291. Okay, critical care evaluation and management. Okay, critical care, critically ill, critically injured patient. I mean, I could think that it's a critical condition, although it doesn't like specifically say that. 99471. Let's try that one. That's tricky because 994737454. It's kind of like all out of order. 994. Seven one, yeah. Initial pediatric critical care per day. Oh boy. Okay, so we have, I don't know. So okay, so he went to the ER. Inpatient pediatric care. So he went to the ER. So we have to have so 460, is that ER? 99. Initial hospital and birthing care center. Oh boy. That's not a birthing center for sure. It's something else. So it's not 460. 71. Okay, maybe, but let's see 291. Critical care evaluation and management. Oh, okay. So yeah, 291. It sounds like it, because you have ER. It's not a critically ill patient, though. Oh, well, I guess so. Neonatologist. Yeah, 291. Sounds like it. What about 99460? Initial hospital or birthing center. Yeah, it's not 460. We just did that. 471. Days through. So it's not 29 days. It can't be 7-1. 99468. Could be 468. So you have inpatient in neonatal critical care per day, evaluation management of critical ill neonate 28 days or younger. So the infant is, I don't know if it's a boy or a girl, but the infant is 20 days old, so that's less than 28 days. And if I look at 99291, yeah, that's like an injured patient, so I think I'm pretty confident in the A. Okay, next one. CPT. Okay, so these are some other codes. So we have the 00s. Those are, what are they? Are they up front or are they at the very back? Let's look. Yes, they are at the back. Okay, so 00. They are category 3 codes, I think. Category 2 codes. Okay. So we have 00840, that's the lowest one. I can't even find those. Let's see. Also can't find these ones. I'm gonna come back, mark that one in red at the end if I have time. So there's a few of these. So we have Anesthesia code. Oh, yes, these are the anesthesia codes. Okay, so those are in NS and they're up front. That's why I couldn't find them. Yes, so these are the anesthesia codes. So we have anesthesia services. Okay, so I can actually go back to that one. So we have 00860 anesthesia extraperitoneal. Oh, 840. We start with the lowest. Anesthesia intraperitoneal procedures, lower abdomen. Okay, yeah, nephrectomy. Okay, I guess that's kind of fits. So we have, let's say 60. Renal, pelvis, diabetes. What are the correct CPT codes? Yeah, it's not kind of matching. So the 840 doesn't match. 62 I would say is renal procedure. Yep, renal pelvis. So 62, pick that one, because it's just the hot word, the keyword there is 60. Renal. If I look at 68, oh, renal transplant, it's got a renal as well. Type 2, what is the nephrectomy? So he just got the ectomy, so basically just removed it. Okay, so 60. There's a, trying to think if there's a better way. No, yeah, there has to be. This has to be done this way, because all the other answer choices don't have that extra thing. So they're all very similar. So 65, 64. I think we can narrow it down with the ICD-10 ones. It has to be with the CPT ones. So we have 00862 and P2. Renal procedures including upper 1/3 of the ureter or donor nephrectomy. Completely stuck on this one. Anesthesia intraperitoneal procedures in the lower abdomen, including laparoscopy. So yeah, the only one that has laparoscopy is this one. The rest is just anesthesia. Well, the whole thing is anesthesia, but then anesthesia for laparoscopy. I mean, that's the only one that kind of fits. Even if I came back to this one, I don't think I can do any better. A healthy 32-year-old with the closed distal radius fracture received monitored anesthesia care for ORIF of the distal radius. What is the code for anesthesia service? So we have 01830-P1. Okay, 01830-P1. Um, 01830. still in the anesthesia section. Kind of fumbling a little bit tired on this one, honestly. So we have anesthesia here. So we have 32-year-old here, distal orif anesthesia service. Okay, 01830. That's where we begin. Okay, 018. Yeah, there we are. Anesthesia for open surgical mass, distal radius, distal ulna. Oh, I'm on the wrong one. So yeah, distal radius fracture, received monitored anesthesia care for distal radius. Yep. So it is for sure one of these 30 ones. So now it comes down to these modifiers. So QS and P1. If I look up front, I'm pretty sure this is one of the ones where it's going to come down to either P1 QS or just P1. Okay, so I'm trying to think of P1, a normal healthy patient. Okay, what is QS? P1, normal healthy patient. Okay, yeah, I mean, we don't have any reason to believe that the person's not healthy. What about QS? Where is QS? I see QN, QM, LT, RT. Maybe it's in the, so there's two sections. One is up front and then one is in the back. In terms of, I would say the guidelines for the, I think the actual, yeah, the guidelines for the actual modifiers. I'm trying to look for that one. Cat 3, Cat 2, Med. So that's Medicare stuff. Mods. So mods tab. So that's the tab right there. 33. So we're looking for QS. We know it's P1 because we don't have any reason to believe that the patient's healthy or not healthy. QS. Double checking. Yeah, QS. There isn't any QS anywhere. So we have the QS. I don't see any QS. I think it's going to select A. The next question. All right, 10-month-old child is taken to the operating room for removal of laryngeal mass. What are the appropriate anesthesia codes to report? Okay. Anesthesia for 00320. Anesthesia for all procedures on esophagus and thyroid. Okay, so muscles, head, neck, posterior trunk. So it can't be 300. There's no anesthesia of esophagus, thyroid, larynx, trachea. So okay, it could be 320. And then 26, could it be 26? In children younger than 1 year of age. Yeah, so I think it's 26 because the child is younger than 1 year of age. It's only 10 months. So it is 26, but is it 26 with 99100? Aha, it says do not report with 99100, so it's just the 26. So it says do not report 99100, so it has to be just 00326. Catheter is placed in the left common femoral artery, which is directed to the right external iliac antegrade. Dye was injected on the right lower extremity. Angiogram was performed, which revealed the patency of common femoral. Why am I reading this? We have let's see, 26217. Initial third or more selective thoracic brachiocephalic branch within vascular family. Thoracic branch. Okay. In the femoral artery. I think probably have to see. Yeah, I don't see any of those things. Thoracic, brachiocephalic, none of that. So let's go to 47. 47. In the vascular family, initial. So even 47 doesn't have, I guess, that degree of specificity. Okay, so maybe. So I see 75736165610. So all of those are different, even though these ones. So I'm gonna base the answer off of the second code on this particular question. So let's go to the second code. So we have the lowest one, 75716. Angiography, extremity, bilateral radiological supervision. Oh. Angiogram, yep. Extremity, unilateral. Yep, so we have extremity for sure. It's more specific, right lower. What about 10? So that's on 10. What about 16? Oh, unilateral or bilateral? Does it say? Right. This is tough. Because the angiography stuff is kind of difficult. So let's see, 16. External iliac. Angiography, extremity, bilateral radiological supervision. That's 75716. Angiography, extremity, unilateral radiological. That's 75710. I don't know. This one is worth either skipping completely or coming back to later on. Okay, so let's see. Detection, screening because the patient's breast cancer, signs or symptoms of breast disease, radiological services. Okay, so something radiological. So we would go now to 77065. Diagnostic mammography, including computer-aided detection, CAD, when performed unilateral. We have, diagnostic mammography, including computer-aided tomography, aided detection, CAD, when performed unilateral. A 56-year-old female is having a bilateral mammogram with computer-aided detection conducted as screening because the patient has a family history of right breast cancer. So we have 77065. Diagnostic mammography, including computer-aided detection. Yeah, that's it. 65 is it, but is it like X2? Let's have a plus next to it. So it's like 65. I don't know if you actually use the X2. I'm going to go with the usual. Okay, and then the next is 29. So 63-year-old patient with bilateral ureteral obstruction presents to an outpatient facility for placement of a right and left ureteral stent, along with the interpretation of a retrograde pyelogram. What code should be reported? Okay, so 52332 and 74425. And then any patterns? No, I think we're gonna have to. This could be either one of those. Okay, let's see. 52332. Cystourethropy. Five, 2, 3, 3, 2. Yep, it's got the heart word. 5, 4, 3, 3, 2. Is it with 50? Is it bilateral? Yeah, bilateral. So I think it's that one. So we pick it. Continue. Patient is coming for a pathological examination for ischemia of the left leg. Specimen is 1.5 centimeter of a single portion of an arterial plaque taken from the leg, left common femoral artery. Okay, great. Answer choices all different. So let's go 88304. Surgical, pathological, so we highlighted intervertebral disc on this one. So what exactly is this? So we have 04 intervertebral. Pathological examination. Okay, great. So we have to for specimen, single portion of an arterial plaque, common femoral artery. So I don't think that one has any, so it can't be 3 or 4. What about 3 or 5? Artery. Yep. So it's 3 or 5 because we highlighted artery biopsy. Ischemia of the left leg. So it's not like a biopsy. Okay, so let's continue. Yeah, on these codes it's tough. I think it's the only one that has the word artery is 305, and that's the one that I'm gonna pick. Just simply because artery is the one we highlighted. It's femoral artery, colon biopsy, bone biopsy. It's none of those for sure. It's good. Move on. We have 31-80500. During craniotomy, the surgeon asked for a consult and sent in a frozen section of a piece of a tumor. Okay, so it's again kind of pathology type of stuff. So we have 80500. Clinical pathology consultation limited without review of patient history and medical records. Okay, so during craniotomy, the surgeon asked to consult a frozen section of large piece of tumor. Okay, so 80500. So that is limited without review of patient history or records. I don't know. I think on that one he actually did some stuff. So we should have started with this one because it's doubled up. Those other ones are probably not the right ones. So we have 88331. First tissue block with frozen section, single specimen. First tissue frozen section. Do I have frozen section? Yes. Frozen section pathology report. So it's 331. But then is it also 88307? Okay, so 88. Okay, wait. Might be a. Sometimes there's a little hint on these questions. Like, do not report with. No hints on this one. Okay, so no units. What we wrote 331. Okay, so let's see. 88332. Each additional tissue block frozen section list. So he got the tissue. He got one block. It can't be 332 because 332 says it has to be like each additional block of section, and it only seems like he's got one block. So that's the one that I'm going to select. Okay, physician orders a basic 80047 and a comprehensive metabolic panels. Okay. Select the codes on the and how it's reported. So have they just given us the answer on this? Okay, yeah, this one. Oh boy. I don't know how somebody would. Anyway, I'm gonna keep that. Might be. I'm not sure what the answer is, so like. Okay, so we have 80053. Aha, comprehensive metabolic panel. Yep. 47. Is there any hint that would say don't report with anything like that? Okay. 80047. This panel must include albumin, okay, if he's ordered both, so what's in the basic? Calcium total, it's covered. Carbon dioxide, that's covered. Chloride, that's duplicated. What else? Creatine, it's covered. So yeah, I think this is the trick. So I think you only report the most comprehensive of the two. So you have to pick the B because it's covers everything that's in the 48, and then it also covers everything that's in the 53. It's the more it's the more inclusive of the two. Okay, so 33. 90713, the same. Let's see on the second code, third code. Where's the differential? All of them look like they have some degree of work. So if we have I'm not sure, these ones are tough. So 90658, let's see that one. Influenza vaccine trivalent IV3 split virus 0.5 ml dosage for intramuscular use. So 4-year-old is getting over his. Okay, so we have getting over his cold, and we'll be getting these 3 immunizations in the pediatrician's office by the nurse. The first vaccination administered is the polio vaccine intramuscularly. The next vaccination is live influenza LAIV3 administered in the nose. Last vaccination is the varicella live by subcutaneous route. What CPT codes are reported for the administration of vaccines? Okay, so 90658. Influenza virus vaccine trivalent IV3. No, it's LAIV3, so that's 660. So 660, so it's either between these two. And then we have, okay, so the differential is going to come from 90460 or 471. So 90460. Immunization administration through 18 years of age. So it's 0 to 18. So that's the right one. I think it's the 6-0 one. I think 7-1 might be the it even says do not report with. I think it's that one, 460 through 18 years of age. So 0 to 18 vaccine toxoid administration is what we wrote. So yeah, I think it's that one. Next, patient with the chronic renal failure is in the hospital being evaluated by a nephrologist after the placing of a catheter into the peritoneal cavity, dialysis, blah blah blah. Okay, so all of these are different. So 90937. So where we begin, 90937. Hemodialysis. Okay, 90937 says hemodialysis procedure requiring separate repeated evaluations. So it's dialysis for sure. Dwelling time, running cavity, volume. I don't know if it's all of that. I think we have so 35 single evaluation. Yeah, it's just one time. It's a one-time deal. So 35 single evaluation. That would be repeated. 37 would be repeated. 47 would be dialysis procedure other than hemodialysis. I think it's actually 45 because it's not a hemodialysis. It's just a regular. It's just a regular dialysis. It's not a hemodialysis. Okay, so 35. Let's see. Established by a patient had comprehensive exam in which she had been diagnosed with dry eye syndrome in both eyes. Ophthalmologist measured the cornea for placement of a soft contact lens for treatment of the syndrome. What codes are reported by the ophthalmologist? Okay, so the first ones are not helpful. I think it's just going to come down to the second ones. So 92325. Let's look at that one. Modification of contact lens. 92325-50. Modification of contact lens, separate procedure with medical supervision or adaptation. I don't know if I see all that. Modification of contact lens, establishment at a comprehensive exam. Yeah, he didn't do the medical supervision, so I don't think you have the. You can really say the 25 code. What about the 10 code? The 310, 92-310. Description of ophthalmological characteristic and fitting of lenses, both eyes except for aphakia. I think we have that. So we have, I think it's going to be the 310 because 25, it's not that one because we looked at that. That's sort of like medication with separate procedure, separate adaptation, and long-term stuff. 72 is 72. It's completely out of order. I don't even know where it is, honestly. 72, 71. Spectacle prosthesis for aphasia. I don't think we have the diagnosis really. I think it's that one. A patient who is a singer has been hoarse for a few months following the upper respiratory infection. She is in a voice laboratory having a laryngeal function study performed by an otolaryngologist. She starts off with the acoustic testing first before she moves to the aerodynamic testing. She complains of throat pain and is rescheduled to come back to have the other test performed. What is the CPT codes reported? Okay, so 92520. I think that's the one. So let's see, 92520. 519. Okay, it's out of order. Where would I find 92519? Let's see if it's like 52 first off. 52 says on the reduced services. I don't know if 52 really belongs. 52 is reduced services. I think it's 52. So we have 92700. Or 92520. Okay, so 92. Is not even there. I'm gonna say 92. Come back to that one if I have time at the end. Okay, let's see. What is the difference between entropion and ectropion? N would be like inward. Ectropion would be facial droop. Okay, so we have to have a place where some of these terms are potentially defined. I'm trying to think about like where in the CPT or ICD or HCPCS or any of these books they have some maybe terms and definitions. Maybe. So if I do this CPT, yeah. So on the CPT, there is a section up front that says we labeled it under not the code, but illustrated anatomical. It was on XX or XXI, which is I guess 20 and 21 pages in Roman numerals. So we have tropion. If I can find tropion as the suffix. Yeah, it doesn't say that. Ec and N. So let's see, EC. Yeah, we need to have a place in these books where some of these terminologies are defined. I know the anatomy courses can sometimes have us memorize all that, but there's a lot of that, so I'm not really sure if I would have that all memorized. So I would say entropion. So entropion, if I go in the ICD-10 and look at E, maybe there is something, somewhat of a hint. So ectropion, EC, ectropion, H02109. So if I go to that, so ectropion was H02109. So I would do H. H02109. So H02102, H02 109. It's something to do with the eye. So you have, it's not feet, it's eyelid, because it says ectropion of the eyelid, and I think on all the other ones, it's I think that's the answer. Perfect. Let's see. Arteriovenous anastomosis is used to increase the blood flow in hemodialysis. Which of the following describes a direct arteriovenous anastomosis? Ooh. Insertion of a cannula, section of an artery neighboring a vein are joined. Artery and vein joining. I don't know if so we kind of need maybe a guide on like anastomosis as like a procedure, I'm thinking. So what we can do is, since it's anastomosis is like a thing that you do, it's not like a diagnosis. I think if we look at the CPT book under anastomosis, I think we'll have some good luck in getting a decent sense of what that is or what that does. Anastomosis. So that's on, all that's like around 33,866. So 33,866. So I can go to that page. 33. 866. So that's going to be placement of distal extension prosthesis delayed after endovascular repair of descending thoracic aorta. I don't know. So that one is 866. So basically 8. I have a feeling it's gonna be. It's not that. I believe it's that one. Donor's vein is used to connect an artery and a vein. Arteriovenous. Yeah, I believe it's B. It's a guess, but I'm pretty confident that it's likely B. Ventral umbilical, spigelian, incisional are types of ventral umbilical. Umbilical cord, ventral. I don't know if they are hernias. Organs found in the I think it's this one. Surgical approaches, because of the incisional, you incise something with surgery. I think it's A. Fracturing of the acetabulum involves what area? So acetabulum, I think that's brain. I believe so. I can check really quick in the netter sections here. So NSSX. And then do we have like X-ray, PNL, Med. Really quick, let me see here. No, acetabulum is leg. Because remember that from one of the anatomy classes. Acetabular notch and all of that stuff, but it could be wrong, so let's just double check. So we have the tabbing here. So we have index. The thing that we put netter was on this side here. So you have E&M, anesthesia, X-ray, med, all of that, E&M, anesthesia, SX, X-ray. I think it was in ICD. Yeah, netter here. So we have. We're looking for. Like a bone. Somewhere with like bones on this. I think it is leg. It certainly is leg, because I think acetabulum is that region where the femur connects to the hip. So I think it's that region there. Okay, so then you have, when a patient is having a tenotomy performed on the abductor hallucis muscle, where is the muscle located? So abductor hallucis, I think that's in the hand. I remember that one because it's hallucis longus, hallucis, or is it the foot? I think it's the foot. Yeah, because the upper arm is, definitely need to review my anatomy. The hand is okay. I don't think it's hallucis longus, hallucis cordis, or short one. think of that one. Abductor hallucis muscle. I think it's, just to not get it wrong, the leg. Abductor hallucis longus. I remember that one. I think it's the upper leg. It's not the foot, but it's hallucis. Abductor hallucis. Gluteus. Aha, extensor hallucis brevis. Hallucis is foot. Okay, so that is correct. And that's in Muscular Anatomy on page 23 of the ICD-10. Okay, so coding. These ones are always tough because those are ICD-10s. So what code should be reported? 44-year-old. Okay, so we have R87619 reported twice. Let's look that up really quick. OPQ, and then R is going to be between S and that one, so we have R. Okay, R87.0. So we have R87.619, R87.619 unspecified abdomen cystological findings in specimen from cervix. Pap smear, gynecological and evaluation. Normal appearing cervix on colonoscopy was benign. Curettage was beginning in the cervical glands and abdomen. Undergoing today. So what is the ICD-10 to be reported? Okay, so we have, so just read through that really quick. I don't think anything just stood out on that. So so R87619 says unspecified abdomen cystological findings in specimen from cervix, uteri. It is unspecified, and that all of that is like the case in this one. So the thing that is what is it C 53.9 or is it Z 85.41? If I go to like Z 85.41, personal history of malignant neoplasm of the cervix. Yeah, I think she's had the history. So you have the Z code. So you report that one. And then what about C 53.9? I think that might be like a cancer. She has cancer or something like that. I think it's Z before C. So that's C. Okay, patient comes in to see her primary care physician for productive cough and shortness of breath, and the physician takes a chest x-ray which indicates that the patient has had double pneumonia. Select the ICD-10 code for this visit. So basically double pneumonia, whatever code it is for that is the right code. And it looks like if I look at J18.9, I think it might be that one. Let me just double check. So J. Pneumonia, unspecified organism. Yeah, I don't think we see any organisms. And then R05. So, okay, so J is chapter 10. So this is where it gets a little bit tricky. So if you have a J code, I think we have to dig into the guidelines. Okay, so J is essentially chapter 10. So we have to go to 10 on one of these tabs. Acute exacerbation of chronic obstructive bronchitis and asthma. So I guess what we're looking for is any guidelines on, hey, don't report R with this or something along those lines. Influenza. I don't see that. So let's see. So it certainly is J18.9, and then R05, what does that do? Let's see, A, B, C, D, E, F, G, H, I, J, K, L, M, N, O, P, Q, R. R05. Cough. Yup, the patient has a cough. R06. Mouth breathing. So they are breathing. Shortness of breath. It feels like this is the most complete, along with the diagnosis and all that stuff. I think if I look at the sequencing, so this is basically that, but like resequenced. So this is where the trick comes in. I think we have. So is it this or is it that? So they came in with this. They have that for sure. I think the answer might be this, because I'm not 100% sure. But like, if I look at the order, it's supposed to be relative to like the value of each. So the most expensive one, so let's see, but we don't have those guidelines. So let's see, we have 10. J. Trying to just scan this for J18 point. Yeah, I don't see anything like that. I think it might just be reporting the order in which they came in. So that they have that for sure. They have that for sure. And then this is kind of like what the physician evaluated. Order it like that, and we'll see what this comes out to. The correct way to code for a patient having. Oh no, but I think diagnosis first. I think that's the rule. Diagnosis first, symptoms second. Okay, we'll see, I guess. Okay, what is the correct way to code for patient having bradycardia due to Demerol that was correctly prescribed and properly administered? Okay, so T402XA1. So I'm flipping to it. Definitely the tabbing here needs to be relative to like ABCs, not 1, 2, 3. There's some error there. So we have ST T40. Poisoning by adverse effect and undosing of necrotics, psychodyslepics, whatever that is. So we have T40.2X. Poisoning by other opioids. I don't know, is Demerol an opioid? I don't know. 'We really just need the Demerol, I think. T40.2XA3. X1A, poisoning by opioids, accidental. What about R00? What about that one? Let's see. ABCD, IgK element. R. Bradycardia unspecified. Huh. It is R001. That's exactly the words. So, and then Demerol must be an opioid. Okay, so then is it... these ones are tough. I have to just go back and kind of just relearn some of these. Honestly, it's not very intuitive as to which code goes first on these. So we know that it's R001. Having bradycardia, so they have the bradycardia. So whatever they have is first, and then T40.2X2A. Initial encounter. Yeah, it wasn't intentional self-harm, so it's got to be the adverse effect of other opioids. It's probably the right one. It wasn't like self-inflicted or anything. Which statement is true? Reporting pregnancy codes. All of those. Okay, these can be used only on maternal and baby records. These codes have a sequencing priority over codes from other chapters. Oh boy. Okay, so we have the O codes. Okay, so O is chapter, let's see, element O. O is so O00. IJK, LM, and O. Okay, so let's see. O 20. O codes would be O codes. So it says 080, 009A. Honestly, I'm probably not going to be able to answer this one. It's going to be, I don't honestly know, because it's these guidelines, fetus identification. It's like 2 or 3 pages of this. Well, actually, yeah, 13. So pregnancy, childbirth, and puerperium. So we have puerperium, so Z. So there's no requirement that this should always be reported with these codes. It's in like a if situation. It kind of depends on whether or not you're in a pregnant state, so it's not that one. These codes, sequencing priority over codes from other chapters. Range from pregnancy, puerperium. Okay. Majority of the codes in 15 have a final character indicating trimester of pregnancy. I honestly don't know. I think it's probably gonna be, I don't know. I think that's just one to relearn altogether. There's no, at least not that I have one currently, a strategy for these. Okay, so then we have, is that 60? So we have 46, ATPCS. Okay, finally. These are generally okay. They're not the hardest questions. So we'll see same strategy as before. PHI, protected health information. Remember that one. So that's good. And actually, I have a full list of acronyms that I put here up front. So if I forget anything, I always just try to have that up here so I can look up where that is. Optical. It's a little bit messy, but I remember that one. That's protected health information. Not a CPT surgical package. I have no idea. I think it's so it would cover all the stuff, but I don't know if it's the area. I don't think it's area specific. It's just kind of like specific to what they do. So this is saying evaluating a patient in a post anesthesia recovery area. I don't think it matters. Like the area doesn't matter, I don't think. So which statement is true about the reporting codes for diabetes mellitus? So you have, if type 2 diabetes mellitus is not documented in the medical record, the default type is who? Okay, so we had, I think it's type 2 diabetes. But instead of guessing, we can look at either I think up front, or we can look at I think it's type 2. I'm gonna select that one, and I'm pretty confident that that's the right answer. Relatively confident. So then you have, which statement is true reporting external cause codes of morbidity? These ones, V00, Y99. All external codes do not require 7th character. I have no idea. I think it's one of those guideline ones. And I don't have a great strategy for the ICD-10 guidelines, honestly. But this one I can do quickly. So that's like a red. I need to study that one. And then this one is gonna be 46. So we have 66-year-old Medicare patient who has a history of ulcerative colitis. Presents for a colorectal cancer screening. The screening is performed in barium enema. For this procedure, okay, so G0104. Okay. So actually we have these tabbed, but I'm kind of fumbling still. G0104, colorectal cancer screening, flexible. Flexible sigmoidoscopy. I think it's just basic screening. But it is 104. Like 105 is colorectal cancer screening. Barium enema. I think whichever one of these has barium enema is the right answer. Yep. Oh, it's 120. 120 has the barium enema. Yep, and we have it in green as well, so that's good. And then last one, morbidity stuff, I have no idea. These, no clue. Okay, so that was okay. So I went ahead and checked my score, and it wasn't anything good at all. It was 24 out of 50, which is less than passing. It's actually less than 50%. So if I had kind of not gone through that exercise here, and gone into the test thinking that, the highlighting of the books and sort of just kind of having some stuff is the best way to do well on this exam, I would have been wrong. I think it just takes a lot of practice and kind of getting used to this style of questioning to actually do well on the test. So it was just a big learning experience, like going through these practice tests, seeing how these questions are phrased, seeing how the different nuances of these questions can they're meant to they're kind of designed to really test your knowledge on stuff. So overall, still, the score isn't passing, but it was just a practice test. So a lot of things to improve on. I think one of the things is to bring the score up. I think ICD 10 was a pretty weak point. In fact, some of those I couldn't even kind of put heads and tails together. Also, just timing, improvement on timing is going to be a big thing. So that took about 3 hours or so to do just 50 questions. And that's nowhere near the proficiency that the APC kind of expects of somebody. So really good reality check. Kind of like this video would serve as a really good, thought process of somebody that's a beginner level individual that's kind of coming in, and then just kind of tracking that all the way through, kind of retaking this one and maybe finding more resources for other tests, and then compiling that together, and at the end of the day kind of coming away with not only just a good strategy for handling these questions, but also just succeeding in terms of the career aspect of it. Because in real life, I think all of us will be utilizing these kind of reading these stories and these things to assign actual codes, which will go to the insurance companies and Medicare or whoever is the payer for these, and they have to be accurate, and they have to be accurate, I think, up to 95%, 98% in some instances. So really good. I think for me it was a pretty positive experience, looking at the score as obviously positive feedback, and really buckling down and studying. Really good reality check.